So next what I'd like to do is I'd like to quickly talk to you about ageism in medicine. And one of the reasons, and I mentioned before in terms of the brain's negativity bias, and I believe that this is where it kind of comes in. The truth is, in medicine or nursing or studying to be a PT or OT, that often our trainees are overexposed to the sickest older adults, the folks who are extremely frail, that are hospitalized. And so what that does is it creates a pattern in terms of thinking that only older adults are sick, are super sick and frail, and are having cognitive problems. And the truth is, not all older adults are truly dealing with so much medical complexity or need extensive care. And this is where this negative bias comes in. So this is what we're often seeing, and this is what we should be seeing. We should be seeing and having just as much exposure to older adults who are vibrant. And by the way, that picture at the end is not photoshopped. She was a gymnast and has maintained her strength. It's really amazing. So another problem with ageism in medicine is that it can have very, very specific negative impacts in terms of care. So one of them is the potential for undertreatment. Sometimes providers can stereotype older adults by applying age-based group characteristics to an individual, regardless if that individual actually has those characteristics. So for example, pain is consistently undertreated among older adults. And that's a problem in terms of undertreating, sort of just saying that, hey, and here's some quotes in terms of people denying medical treatment due to these ageist assumptions. Having more aches and pains is an accepted part of aging. Live with the pain. The human body is like a car. When it gets old, it gets worn out. Deal with it. It's normal to be depressed when you are older, which is not true. If you've seen one 85-year-old, you've seen another 85-year-old, which is not true. We're all unique and different and distinct. And so by applying these ageist beliefs, we're denying people access to care, things that we can intervene on. One thing that really troubles me is when older adults feel that their sleep disturbance is just a natural part of aging, where we know that a lot of addressing sleep problems is modifiable. Then there's the potential for overtreatment. I know you guys can't really see this video, but or this cartoon, excuse me, where it says there's nothing wrong with you, but I think everyone your age should be on at least one medication. So here, the potential for overtreatment is, of course, also just looking at someone's chronological age and not looking at really what's going on with their health and well-being and making recommendations that are not necessarily warranted. The lack of evidence of benefit without assessing, like what is actually going on with that individual, and just making gross generalizations is a problem in terms of potential for overtreatment. There was a campaign started by ABIM Foundation called Choose Wisely. It was started in 2012, and the American Board of Internal Medicine launched this campaign to try to identify commonly used tests and procedures that really lacked solid proof of benefit and may cause harm. For example, imaging tests for lower back pain, or annual electrocardiograms for low-risk patients, or pap smears for cervical cancer screening in women over 65. I like my videos. This is another video talking about, and it has text, so please follow along. Studies have shown that bias against age can negatively affect older people's health. Researchers at Yale University analyzed 422 studies involving ageism in 45 countries from 1970 to 2017. The studies found that ageism was related to worse health on 11 measures. 4 of them were structural, and 7 of them were at the individual level. In 85% of the studies, ageism was linked to older people being denied access to healthcare treatments. In 95% of the studies, there was evidence that ageism affected psychiatric conditions. There was encouraging news in the findings, however, about the benefits of countering ageism. When older people adopted a more positive view of their age, they had less anxiety and suicidal ideation. The data also suggests that improving education for healthcare providers could alleviate a lot of these negative impacts. And now I want to share with you just some other studies that I've accumulated around how ageism by healthcare professionals have undermined quality of care. So one study, actually 2 studies done in 2002 and 1999, they found that physicians and nurses that were patronizing to older adults, that they do not engage with older adults in clinical decision making. That physicians tend to be less patient and less respectful or less involved or less optimistic with older patients compared to their younger counterparts. That nurses' negative attitudes towards older patients and treatment detachment were reflected in low expectations for rehabilitation. And that one study analyzed videotaped encounters between physical therapists and older patients and found a distancing and indifferent behavior, like, for example, not smiling or looking away from the client, were related to negative short and long-term health outcomes for the patient. So one way that ageism creeps into the medical setting, the medical context, is through the language that we use. So I want you to be really mindful every time we note and chart that we have to be very careful of the language that we're using, that it shouldn't have these negative judgments in terms of being helpless or cranky or fragile or useless or grumpy, and often the overuse of the term senile. Communication challenges, absolutely. With a lot of our older adults, there are sensory deficits, but sensory deficits don't necessarily mean that you have to start yelling and screaming at people to be able to communicate. Unfortunately, this is a tendency when people are not sure if an older adult is understanding what is being said, to talk loud and to yell. And the truth is, the older adult internalizes that, and it's perceived as being patronizing. And often these older adults will then sort of retract from wanting to talk to you as a provider and engage with you. And then I want to talk to you about a particular linguistic register called elder speak. It's just like with mothers, called motherese, that there is this register that a lot of people are in healthcare fields are not aware of, where they use this patronizing elder speak, where they talk slowly with an exaggerated intonation or an elevated pitch or volume, or they might repeat things over and over again or use simpler vocabulary. Older adults that perceive elder speak perceive it as being demeaning, resulting in lower self-esteem, withdrawal from social interactions, depression, despondency, and social isolation. This is, I think this might be maybe not my last video, but I really love this video because what it does is it highlights how in our society we have come to embrace some ageist expressions and think of them as not being problematic. And so this is one particular compliment that we should all stop giving.
All right. How you doing?
Hi, good.
Like, you ever done this before?
No. It's exciting.
So tell me, how old are you?
19.
24. 29.
I'm 41. I'm going to be a mother for the first time.
42.
71.
I'm 74.
I'm ready.
Okay, so we're just going to talk. You're going to show me stuff. Do I need my glasses?
I'm going to show you some slides, and I'd like you to fill in the blank and put the words "for her age" at the end of the sentence.
All right.
She has flawless skin for her age. Beautiful for her age.
She looks better than most 20-year-olds for her age.
She looks great.
She is beautiful.
Fierce for her age.
In burlesque, I love it.
That might be a little bit inappropriate for her age.
Jane looks amazing for her age.
She doesn't look her age. She's pretty hot.
For her age.
For her age. Her age. I'm going to show you some other slides now. So I'm just going to ask you to read the sentences that we provided for you.
Okay.
She dances well for a white girl.
She dances well for a white girl.
That's not nice at all.
It's just ridiculous.
She's rich for an immigrant.
No. That's so gross.
She's funny for an Asian. Oh my God, they're getting worse. Well, this girl's half Asian, and me and her dad are pretty freaking funny, so she's gonna be funny.
She's pretty for a thick girl. I hate that. Beauty should not be defined by your size. Yeah, I hate that. She drives well for a woman.
You can't think like that. And then you bring up your kids like that. Then you have a society like that. We got another one? Is it gonna be worse? There we are.
She looks good for her age.
So I didn't expect this to fall apart. They're all the same, narrow-minded and ignorant.
I'm guilty. I say for her age all the time. It's harder to look good in your late 40s. You can be hot at 23 and you just roll out of bed.
Sometimes I think it's good and sometimes I don't.
I didn't realize I was really insulting anybody because it's only because if someone says it to me, I think it's good.
It's not a compliment.
It's really like a backhanded compliment.
I think it is a bias. People are definitely labeled by their age.
I guess for her age is more commonly accepted. This is okay to say, which is like, why?
You look good is a lovely compliment, but to qualify it, you're saying, well, in comparison to the mainstream of beauty, you don't look good, but you look good for how old you are.
It's degrading.
I think everyone should understand this. I think people will be treated differently.
Say you look good, period. You know, don't add for her age.
No, I'm going to leave the for your age part off.
Unless you're asked these questions, I don't think you have the mind to start this conversation.
You know what? Everyone's gonna get older.
I love this. This is brought to us by also AARP, Disrupting Age. They make some really wonderful videos.